Hey guys, welcome back. Dr. Ilana Gelman here, naturopathic doctor. So last week we spoke about balancing hormones naturally, and I specifically explained a disease called PCOS, Polycystic Ovarian Syndrome. Today I want to continue the video on PCOS and explain to you a main treatment that I always recommend to all PCOS patients, and I also recommend to a lot of women who have the susceptibility of getting PCOS to really prevent it. So the main treatment that I want to talk to you about today is diet, and is talking about a low carbohydrate diet. Something that I'm really fascinated with these days is specifically the paleo diet. And I'm going to talk to you about eating a low sugar diet because PCOS has a susceptibility of having insulin resistance. I spoke a little bit about that in my last video. Essentially what insulin resistance is where the body does not use sugar as efficiently as the body should. So our cells don't take in the sugar as easily as it should. Our metabolism gets completely thrown off because our body is not using sugar properly. And we need to now reset our metabolism, and we need to reset our cells to really be able to take in the sugar the way it's optimally supposed to function. In order to do this, we really need to change our diet so that our bodies then can reset, and then subsequently our hormones will then balance out. I've seen this time and time again where my patients with PCOS, they have hypoglycemia or hyperglycemia. More often hypoglycemia, where they get so shaky and so antsy if they're not eating regular meals. And this is just because their blood sugar is not regulated. If you're already feeling that way, if you're feeling lethargic throughout the day, if you feel a drop in your energy right after a meal, or you find that you have no energy, you eat a meal, and all of a sudden you have all this energy, you're just too sensitive to sugars in your bloodstream, and then it's causing insulin resistance. And there's so much detail to this, but I'm trying to make it as basic as possible to understand. So I hope you guys can understand this. So what I want to explain to you now is really the treatment and how I explain what a low carbohydrate diet looks like to a patient. So when I think of sugars, I don't just think of it as white sugar in desserts or sweets. When I think of sugar in a lot of different forms. Even complex carbohydrates turn into sugars in our bodies. So this includes wheat, so breads and pasta. This includes grains like rice and quinoa and amaranth and barley and oats. All of these things still convert into sugar, and so our body still recognizes it as if you're eating a piece of cake or if you're eating a piece of bread. Our bodies process it just like sugar. The other thing that our bodies look at as sugar is fruit. Fruit is very nutritious in many ways, although fruit is very high in sugar, and that sugar is called fructose. Now, for people with PCOS or people with who are predisposed to PCOS or has blood sugar problems, even something as healthy as fruit can really be a problem for you guys, and so you have to be aware of this. So the way that I like to recommend diet to these patients is that every meal I want you to focus on three things. I want you to focus on a healthy fat, healthy protein, and a lot of vegetables that are lower in carbohydrates. And every meal should combine at least three of these things so you're getting a complete meal. If you're getting hungry throughout the day, I really want you to focus on eating more fat and eating more protein, healthy fats and healthy proteins. And I'll go into that in other videos after this, but it's really important that you guys limit your sugar intake, your grain intake. That includes wheat, that includes oats, barley, rice, quinoa, and you focus, if you're going to have carbohydrates, on the root vegetables. These include your yams, your sweet potatoes, your winter squashes like acorn squash and butternut squash, carrots, beets, potatoes. Those are the carbohydrates that I want you guys to eat when you're eating carbohydrates. Other than that, the best diet for patients with PCOS or those who are predisposed to PCOS, really truly limit your grain intake, your sugar intake, and your fruit intake to really focus on just the root vegetables, and then your healthy fats, healthy proteins, and then your vegetables. All right, you guys, I hope this is the biggest takeaway for you guys today to really prevent PCOS, to treat PCOS, and to really balance your hormones in general, naturally, is with a low carbohydrate diet, specifically a paleo diet. More videos to come on what that means, on what paleo means. All right, you guys, I hope this was helpful in the short little tidbit for the week, and we'll continue next week with some more information. All right, you guys, take care. Bye-bye.